Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and today we're going to talk about those sequential distalization cases in clear aligners, whether you're doing Invisalign or ClearCorrect or one of these aligner brands that does allow sequential distalization properly. You do know those cases can take some time, and quite commonly they do have one or two refinements. It's a challenging movement to take a molar and drag it back, and then drag the next one, and then drag the premolar. That's what sequential distalization is all about. So you have to expect, if you're going to have one of those cases, that you need to take it slow and low at like 50 to 100 on the liners, and expect that you're going to have at least one or two refinements. It's normal. It's how it is. Anyways, when you do those refinements, you're going to do it a little bit differently than the traditional refinement in terms of what you need. Traditional refinement, you're going to take a scan, a set of photos, make sure you get bite marks on those photos. What else? Sometimes it's nice to have a panoramic x-ray so you can check those roots, make sure they're upright, but that's pretty standard stuff, right? For a sequential distalization refinement, you're going to want to add on to that. So you want to map the spaces in the back of the teeth. So I don't know what stage you're in, whether we kind of just only dragged some of the teeth or all of the teeth, but you want to map the spaces. If it's a light contact, I like to point it as a 0.1 and just use traditional dental floss to check it. If it's an open contact, then I'm going to go ahead and get my IPR gauge, and I'm going to measure it 0.2, 0.3, 0.4, 0.5. It probably is not bigger than 0.5. You can theoretically stack your IPR gauges, so you could put a 0.5 with a 0.4 if you really needed to measure, or you can use a bully gauge as needed. But I think the most I normally do on a sequential case is, a 3 millimeters, 3.5 on top, maybe 4. I've done that. Obviously you're going to want to take a cephalometric x-ray and make sure that's okay for the soft tissue. On the lower, maybe 2. But you have to look at the bone and see what you're doing. But it's a great idea to map it, to mark it down. I know it's a little tedious to mark all the sites. Unfortunately, I do have an IPR form, so if you need that, I can always give it to you. But it's one of those things you just maybe write it in your progress notes exactly what the spacing is. Then when the Clincheck or the Clear Pilot setup comes back, you can cross-check it against what you had and make sure, especially those small spaces, are picked up properly, because you want to make sure that it's there. You could always add ghost IPR as needed to your next setup so it's accurate. But it's a great way to chart. And also, a lot of times with sequential distalization, we're doing pure sequential distalization, which means we're not aligning the front teeth until we've created space in the back that we can use for the front teeth. So a lot of times they're not seeing a lot of change in the front, but they're just getting gaps in the back. So it's great to mark it down just to say, hey, yes, you're getting this progress. This is great. We're making progress. We can use this space shortly. So hopefully that was helpful. Again, this is for sequential distalization cases only. All right, thanks.